Hello and welcome to the tutorial on the scalp. The scalp is going to be the soft tissue envelope for the cranium. It's actually going to extend from the superciliary arcs anteriorly to the external occipital protuberance and the superior nuchal lines posteriorly. The scalp is going to be multi-layered and it's going to have 5 layers. And to remember them easily, you use the mnemonic scalp. S for skin, C, connective tissue, which is actually going to be dense connective tissue. A for the aponeurotic layer, the gallia aponeurotica. L for the loose connective tissue. P for the pericranium. To begin with, the skin is going to be thick and it's going to resemble the skin that you find on the soles of the feet and the palms of the hand. The skin is going to be hairy except over the forehead, and it's actually going to have numerous sebaceous glands, right? Then if you look at the connective tissue, that is going to be dense connective tissue, and that's where you find the major neurovascular bundles of the scalp. They're going to exist within that connective tissue layer, which is actually fibrofatty, right? And you're going to have fibrous septa that are then going to tether the skin to the aponeurotic layer. The first 3 layers, that is the skin, the connective tissue, and the aponeurotic layer, they'll be referred to as the scalp proper. They'll actually slide as a unit. So in this layer, you find numerous vessels, arteries, and veins, and you also find nerves. And there's a free anastomosis within that connective tissue layer between the vessels of the external carotid and the vessels of the internal carotid. I'll end by drawing a diagram to show the nerve supply and the blood supply of the scalp, but for now, let's describe the layers. Then the aponeurotic layer, or the aponeurosis, your gallia aponeurotica, the epicranial, it's going to be a thin tendinous sheet that unites the 2 frontal bellies and the 2 occipital bellies of the occipitofrontalis muscle, which is one of the muscles of facial expression. This muscle will thus be innervated by the facial nerve, which is the nerve that innervates muscles of facial expression, right? So that's the aponeurotic layer. And this aponeurotic layer laterally, it ends where you're going to have the temporal fascia. And previously, we have said the temporal fascia was actually going to be attached onto the superior temporal lines, and it is the thickest fascia in the body. Then you have the loose areolar tissue. This is going to be the dangerous layer of the scalp, and you can have collection of blood within this layer. And if you look at the occipitofrontalis muscle, posteriorly it is attached to bone, laterally to bone, and anteriorly it does originate from the skin that overlies the eyelids. So the blood that collects within this loose connective tissue can freely track anteriorly, resulting in the black eye, what you commonly refer to as raccoon's eyes, right? So that actually occurs in this loose areolar tissue, right? And where we said that is the dangerous area. And in this loose areolar tissue, you find emissary veins, an example being this one. And these emissary veins, they are actually valveless, and they act as a channel of communication between the superficial veins and the deeper veins. You also expect to see that these veins can be a mode of infection route. So infection can travel retrogradely or anterogradely within these veins, either superficial going deep or deep going superficial, right? So we say the bleeding can actually result in a black eye. Then this is going to be the pericranium, right? This is basically the periosteum that covers the outer surfaces of the bones. Remember bone histology, how you had periosteum and endosteum. And in the periosteum, you can then start to appreciate the dura mater, which are part of the meninges that are part of the brain coverings. You can have a subperiosteal bleed, right? That is actually going to result in what is known as a cephal hematoma or cephal hematoma, depending on pronunciation, right? Then you can have on birth a bulge on the skin of the baby that is on the part that was presenting. That is known as caput succedaneum, right? Then to describe the muscle that we said was going to have this aponeurosis, it's going to have two frontal bellies and two occipital bellies. Then, of course, they're joined by the aponeurotic layer. The occipital bellies will attach onto the highest nuchal line that you find posteriorly, right? Whereas the anterior bellies would be attached to skin, like we said. And these muscles, they insert into this gallia aponeurotica. Nerve supply to the muscle is actually going to be cranial nerve number 7, the facial nerve. Movements of the muscle, they're going to raise the eyebrows, right? Or we say they move the scalp on the skull. So if you raise the eyebrows, that's a facial expression of surprise. So it is considered a muscle of facial expression, right? Then if you look at the other actions, you can also say it's responsible for wrinkling the forehead on top of raising the eyebrows. It also draws the scalp backwards in the case of the occipital bellies, right? Then if you then look at the muscle itself, the occipital bellies are fairly separated as compared to the frontal bellies, right? Then I'll annotate the nerve supply scalp. I'll basically use one side. Let's say that's the midline. Right? Then we have the ear somewhere here. Right. So the nerve supply to the scalp basically comes from the trigeminal nerve. V1 ophthalmic, V2 maxillary, V3 mandibular. Right? And then you also expect to divide these nerves into those that supply anterior to the ears and those that supply posterior to the ears. So you expect to find supratrochlear here and supraorbital nerves. These are nerves that are actually coming from the frontal, that is coming from the ophthalmic nerve. Right? Then you have a zygomatico temporal nerve, which is coming from V2. Then you have the auriculotemporal nerve somewhere here, which is V3. Remember, V3 would divide into an anterior division, which is mainly motor, except the buccal nerve, and a posterior division, which is mainly sensory, except the nerve to the mylohyoid, which will be coming from the inferior alveolar nerve. So the auriculotemporal nerve is one of the 3 branches that emerge from V3. It supplies the scalp in this region, right? These are the nerves that are coming from V3. Go posteriorly, you're going to appreciate the 3rd occipital nerve. These are now nerves coming from the cervical region. 3rd occipital nerve, you have greater occipital nerve, you have lesser occipital nerve, and you have the great auricular nerve here. The great auricular nerve will be C2, C3. It's actually part of the cervical plexus. The lesser occipital nerve is anterior rami of C2. Remember, the skin on the back will be innervated by posterior rami. The posterior rami for C2 will give you this greater occipital nerve. Then the 3rd occipital nerve will actually be posterior rami for C3. On this other side, let's show the blood supply. The blood supply will come from the internal carotids and the external carotids. If I remember quite well, when we started, we say that you're going to have anastomosis within the connective tissue layer between the vessels that are going to originate from the internal carotid system and the vessels that are going to originate from the external carotid system. From the internal carotid system, you appreciate the supratrochlear and the supraorbital. These are from the internal carotid system. From the external carotid system, you appreciate the superficial temporal arteries or vessels that are going to be part of one of the terminal branches of the external carotid. Of course, the other ones being the maxillary vessels. Behind the ear, you expect the posterior auricular vessels and the occipital arteries. These are going to be the two posterior branches of the external carotid. One from the medial will be your ascending pharyngeal, which will be going to the pharynx and part of the brain. Then you also have three that are coming from the anterior surface, the superior thyroid. Then you have the lingual and the facial itself in that order. Right. So this is going to be the arterial supply of the scalp. The veins will follow a similar pattern. And the deeper structures of the scalp would drain via these emissary veins that we say they're actually valveless, and they communicate with the dural sinuses of the brain. From this picture, we can appreciate the superior sagittal sinus. Then the lymphatic drainage of the scalp, you can also divide it into those lymph nodes that drain in front of the ear and those that drain behind the ear. Behind the ear, you expect the mastoid nodes, right? Then in front of the ear, you expect the preauricular nodes or the parotid nodes. That is the lymphatic drainage of the scalp. So that's just about it for this short tutorial on the scalp.